Here's the problem. Healthcare students, such as nurses, nursing assistants, and healthcare assistants, are dropping out of school, and they're dropping out after they've already entered their program of study. Now, why should you care? Individually, we all prize the highest level of healthcare that can be provided to us. If I were admitted to the hospital, I would want the entire healthcare team to be focused on my needs. But healthcare providers must share their attention amongst increasing numbers of patients. This means that staffing is a problem, and the demand for healthcare graduates is actually quite high. So if the demand in the market is there and our students are working so hard to get into our programs, how come they are not successful? The question becomes, how can we keep or retain our students in our healthcare programs? Let's see what works. We already know that in undergraduate, mentorship opportunities and orientation help retain our students through their first year of undergraduate education. But healthcare students have additional problems that limit persistence, such as their understanding of educational and institutional supports, as well as just general lack of preparedness for their educational outcomes. So how can we take care of those problems while still supporting our students? I propose that we improve all of the issues with mentorship added to orientation and maintained throughout the student's course of study. I believe that mentorship will improve the social supports that students have, and through mentors guiding students through institutional supports and ways to prepare academically, we will see that the student will report improved perception of mentorship at the end of their first semester of study. I'm going to measure this using the CSMS, which is the College Student Mentorship Scale, and it analyzes information in 4 distinct categories, utilizing questions like, is there someone in your life that provides suggestions for academic performance? The student at the end of their first semester is going to take this survey, and ideally, I expect to see high levels of perception in most students. If we see high levels of perception, can we compare that to the dropout rate and the previous dropout rate from the previous cohorts? I expect that there would be an inverse relationship between mentorship scores and attrition or dropout rate. This would help make a case for change in the program policies to include mentorship as part of orientation. And once we add that improved case for change, now we can break the cycle. And the cycle is that we see an increased retention. Increased retention means increased graduation and more graduates by your bedside. So consider this. When you are sitting in the ER and you have an hour-long wait, you feel terrible and in an uncomfortable chair, that one person who was retained could be the one graduate that is working in that hospital that cuts your wait time in half. And wouldn't that make a difference to you?